Hi everyone, Ashlyn Giza YouTube channel. Today we are going to talk about arthritis. The reason why I'm talking about this today is because I recently went to the chiropractor and my pain in my shoulders still kind of wasn't going away. So I thought, okay, I need to ask the chiropractor if he can maybe take an ultrasound or x-ray of my shoulder because the pain's still not going away since November 4th of 2021. I'll never forget the day that my pain started. I've been doing chiropractic treatments and stuff like that just because I like to do more of the natural treatments before I go on to doing like the medications and surgery and stuff like that. Um, anyways, um, nothing seemed to work except for getting adjusted and then taking ibuprofen. And I use this stuff too. This is amazing. Cold as ice, pain relief, and it has hemp extract in it. And um, my chiropractor looked at it and he said, yeah, this is really good, but it's menthol's the main ingredient in this. So what it does is I'll put it on my shoulder where it hurts, and it'll be go from hot, kind of even a burning kind of sensation to cold, really, 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 really cold, like it's an ice pack. Um, but you can get this on Amazon, and it works amazing. I also got this hemp shoulder back support to keep my shoulders back and my posture better. And and that seemed to help too when I used both of those. And if I used what do you call it, like a heating pad and an ice pack. So if I did all that, it turns out to be fine. So it's the pain comes and goes, but I noticed this whole winter it just has been killing me. My chiropractor said it could be from using my phone a lot too, because I work from home on my phone. And I do these YouTube videos holding my phone too, because I don't have well, I have a PC, but it wouldn't be good for making videos because it's an older PC. I might as well use my phone. But he said it's from using my phone too, and age. And when he said aging, I couldn't believe that. I was like, wow, so I'm getting all this pain just from aging and stuff like that. Then came another word, arthritis. So he said that I can't remember which type of arthritis that he said it was, but I have arthritis in my shoulder, and it's due to age. So thumbs up, that's great. But I'm gonna read some stuff to you guys on the web, in case you're kind of having the similar aches and pains that I am. So how I describe my ache and pain is it feels like I tore a muscle, or like just an annoying, agitating pain. That's exactly how I can describe it. So I looked up stuff on the web like I normally always do, and I'm going to read you guys some stuff from there. So, one moment. So, arthritis. Arthritis is a joint inflammation. Usually, the specialists that take care of this type of situation is primary care provider, rheumatologist that specializes in arthritis and other rheumatic diseases. Sorry, I'm probably not saying that right. And physical therapist restores muscle strength and function through exercise. Okay. Arthritis is an inflammation of one or more joints causing pain and stiffness that can worsen with age. And that's another good way to describe my pain and annoyingness is it does feel like my shoulder is really stiff and it needs to be stretched. But so it's inflammation in one or more joints causing pain and stiffness that can worsen with age. Different types of arthritis exist, each with different causes, including wear and tear, infections, and underlying diseases. It's very common, more than 3 million US cases per year. Treatment can help, but this condition also can't be cured. Um, some requires a medical diagnosis, which my chiropractor diagnosed me with that. Lab tests or imaging often required. Or chronic can be lifelong, but my chiropractor did not say it was chronic, so that's a good thing. But I guess I won't really know unless he decides finally to do X-ray. So symptoms they include pain, swelling, reduced range of motion, and stiffness. People may experience pain in the joints, ankles, back, fingers, hands, muscles, neck, or wrist. Pain type can be intermediate or sharp, and pain circumstances can occur while sitting. Joint stiffness, tenderness, or swelling. Muscular is decreased range of motion, difficulty walking, or muscle weakness. A hand, in the hands, it would be a bump on the finger or bony outgrowth in fingers or toes. So if you've ever seen like elderly people with like bumpy crooked hands, that's probably arthritis. The whole body, you can feel just fatigued or just not well. Also, common thing that people can experience is flare, physical deformity, redness, or stiff neck. So those are some things about arthritis. Treatments. Treatments consist of self-care and therapy. Medications, physical therapy, or sometimes surgeries help reduce symptoms and improve quality of life. So therapies would be hydrotherapy, stretching, massage, and acupuncture, which I'm really thinking about getting some acupuncture done to my shoulder. Self-care would be physical exercise, weight loss, which I really need to get on that weight loss kick, you guys. Yoga, heating pad, ice packs, which I've been doing those, and cold compress, which is kind of the same thing as ice pack, but just like a wet cloth or something. Medications would be non-steroid anti-inflammatory drugs or steroids, or a narcotic or immunosuppressive drug. And sometimes surgery is a treatment for like a hip replacement, knee replacement, or joint replacement. But for me, I don't think it's that. It's not going to that. So some self-care things could be aerobic activity for 20 to 30 minutes 5 days a week can improve cardiovascular health, and if injured, pursuing an activity that avoids the injured muscle or joint. Weight loss, Tai Chi yoga, and again, the heat and cold compresses. So, going on down, let's see. Well, I think I got all of it. So that's a lot of information about arthritis, but there's a whole lot more to it. That's why I always say talk to your doctor or chiropractor or surgeon or any doctor that has you as a patient, because I'm certainly not a doctor, but I just like to search things from the web and inform you guys on what I found and tell you guys like personal stories that tie in with the stuff that I find on the web. So for me, I found that since my pains in my shoulder/back area, because it's the back of my shoulder, I like to take this sounds crazy, but it helps. I like to take a golf ball or a tennis ball and put it on the ground and lay on it and roll back up and down on it. It feels like the ball really gets in the area that I'm having like that annoying agitating pain. Or I've also watched YouTube videos where they tell you that you can put a ball in pantyhose, and you can like kind of throw the pantyhose over your shoulder and then lean up against the wall and then go up and down uh, on the ball against the wall, if that makes sense. Um, so there's that too. And of course, you know, if you have a significant other like I do, um, when you're home and you guys aren't doing anything, have them rub and massage the area that's irritating you. So I'm I this has been going on long enough. Like I said, November 4th of 2021. So a few months now to where I'm kind of getting to the point where I think I am going to finally tell my family doctor about it and get an x-ray, because um, my chiropractor is probably right. Um, but just I the reason why I think I'm going to go to my family doctor finally and tell him about it and have him do an x-ray is for me, is for my mental mind. Because I need to know for sure, like see it myself, even though that my chiropractor is a very smart man and he's probably 100% right. I still want to see like visually for myself an x-ray showing that I did not tear or injure my shoulder, because it really sometimes some days feels like I did injure it. So um I think that's what I'm gonna do next is tell my doctor my shoulder is still bothering me and have an x-ray done. So if you guys have ever dealt with this, if this sounds like pain, the same kind of pain you're having, let me know what your doctor said. Let me know some of the tricks and tips that you guys did, because I would love to know, because this is killing me. But otherwise, I will be on with another life topic.